For those of you that don't know me, my name is Jen Wisdahl. I am the COO for FASD United. I'm fortunate enough to be able to get to work in the policy space, and I am the resident nerd at FASD United. So tech is my jam. So I'm feeling a little betrayed by by tech today. Joining me is Susan Shepard Carlson, chair of FASD United's board, and then also chair of the Policy Center. Typically, we do have another colleague, Chris Melfi, monitoring the chat and doing the recording. And unfortunately, he is unable to be with us today. I think he caught a little something over the holidays, as I think many have. So we'll go ahead and proceed because this is a pretty exciting meeting. So before we get too deep into the policy side of things, I wanted to turn things over to Tom Donaldson, president of FASD United, and ask him if he's got any updates he'd like to give.
Hey, Jen. Hi, everyone. Really just well wishes to everyone during the holiday season. And a big thank you to all of you for contributing to the success, not just, of course, of FASD United, but throughout the FASD community. And we're looking forward to a great year next year. So just many exciting opportunities to come. And just a reminder, we still have a few days left this year, so please do support your favorite FASD charity and enjoy your family and the remainder of the holidays. Thanks, everyone.
Thank you. Susan, did you have any updates from the affiliate network that you'd like to share?
We had a really exciting year. We added several affiliates. We're looking forward to the 2024 year. We are working on a regional model for affiliates, and that's especially going to be helpful across our country where we have some areas where we have no representation. Place some states together to collaborate where we can get some representation. And want to thank you all for the work you did last year and wish you a safe and happy New Year's celebration.
Thank you. And quick reminder, 'tis the season. The work that we do in the policy space is funded through donation. And so if you are able to give, we'd appreciate it. But giving to any FASD related charity is important. We also do still have some of our holiday ornaments available. Also of note, we will be moving mid-January to our new facility in Georgetown. So we do have a new address. You may wish to make note of it, but you will also receive emails letting you know about the new address too. Registration is now open for the 9th International Research Conference on Adolescents and Adults with Fetal Alcohol Spectrum Disorders. Say that 10 times fast. And really hope to see all of you there. I think this is a great opportunity to kind of marry policy with practice when it comes to FASD, and then also get the living experience perspective on that. So looking forward to seeing everybody in Seattle in April. So, reason we're here today, and we're going to be bringing this up a lot more over the next year. We always talk about how FASD needs a seat at the table, right? That conversations are happening around autism or other disabilities, or things happen and we're like, why was FASD not included in that? And so over the next year, as a community and as FASD United, we want to be working on giving FASD a seat at the table. And that's not a demand to people to give FASD a seat at the table. It is a request, absolutely. But it's also actions that we can take and things that we can do to ensure that we are giving FASD a seat at the table. And we'll go into that a little further later on. But I think it's important that we just frame it that way, that it's giving FASD a seat at the table through our actions, and then also by making the request, right? and asking others to give FASD a seat at the table too. So conversations around policy, FASD definitely needs a seat at the table. For those of you new to our policy forums, and there's a few of you, just a quick primer on the FASD Respect Act 2.0. That's Senate Bill S 1800 and House Bill 3946. And what it does, in short, it's a reauthorization bill that reauthorizes the Centers for Excellence and other funding programs that provides funding to states to begin to look at their existing infrastructure and see where FASD can have a seat at the table, to see where FASD fits into their existing programs and services. And that's the section on building state and tribal systems. So some really cool news. Every month we look at our pathway to law. And every month you can see we've had a little bit of a traffic jam in committee. And if you haven't heard the news yet, if you didn't hear me screaming at the top of my lungs from Washington State all the way to Washington, D.C., the FASD Respect Act was included in the Support Reauthorization Act in the Senate, and it made it through the Senate Help Committee. And why is that important? Why does that even matter? We have not had legislation pass through the Senate Help Committee in easily 20 years. This is the first time that's ever happened. And that is due to the work that all of you have put in around the country. So it is included in the Support Reauthorization Act on the Senate side. On the House side, they passed a version of the Support Reauthorization Act quite a while ago. And unfortunately, our language was not included in the House bill. So what will happen next is kind of a little bit up in the air, but in a nutshell, the two bills will go to what they call conference, and they'll look at the two different versions of the bill, House and Senate leadership will, and decide what gets to stay in the final bill and what gets put out of the final bill, right? And that way they can get them to match and get them through. So this is a really good sign that we're in there. It's a really good sign that we have solid support, but it's also a really good signal and flag to us that our work isn't done yet, that we need to keep our legislators, keep giving FASD a seat at the table with our legislators by having the meetings, contacting our two senators and our rep, and getting them to co-sponsor and be a part of the FASD Respect Act and its success. Let's see. I'm just checking the chat really quick to see if there's anything important in there that is needs a response to, and I apologize in advance for having to go back and forth.
I just want to add, there is a possibility that this could be confereed in what we would call informal conferee, where it would not go, where the committee staff along with the speaker and Senate leadership would conferee it. So we just don't know. We know that they probably weren't going to do it before the holidays, and they didn't. So we're looking after the first of the year, some action. And this is the Support Reauthorization Act is not a controversial. It's reauthorization of a number of programs through SAMHSA. We're really, really lucky that we're in that bill because it's going to pass. I mean, that we're in the safest vehicle as possible. And, you know, and our bill is not controversial. So I think we're pretty golden. So I'm a optimistic person, but I'm feeling really, really good about where we're at right now.
Agreed. Liz had a question in the chat. The FASD Respect Act was introduced in the House. However, it was not included in as an amendment to the Support Reauthorization Act. So the Support Reauthorization Act is what we refer to as a vehicle bill. It's a larger kind of package of bills because right now Congress doesn't pass standalone bills typically. They only pass big packages of bills. And so the Support Reauthorization Act is a package bill that the FASD Respect Act, which was introduced in the House, and that's why we have all the co-sponsors for it, just didn't get included in that package bill when they were developing it. And the Support Reauthorization Act did pass through the House. It just passed through the House without having our language included in it. So that's where the House bill and the Senate bill are different. There's a couple of differences there, and they'll have to figure that out in conference. All right, any other questions on that? And feel free to raise your hand, unmute yourself, throw it in the chat. Joel, you have a question.
Yeah, so can the bill get thrown out if it's part of a package? Is that a possibility?
It is a possibility. It could happen. So the FASD Respect Act in conference, when they're deciding, to create the final version that looks the same between the House and the Senate, it is possible it could get removed. I don't think that's going to happen. We've paved the way by meeting with a leadership on the House side. We've got great support on the Senate side. I think we're in a very good position, but this is again where our next steps are very critical. It's not quite the slam dunk, we're going to need to be continuing to meet with our legislators, keep it top of mind so that it's not something that they see as a bargaining chip to be bargained out. That's why having co-sponsors on the bill on the FASD Respect Act and putting our focus on the FASD Respect Act, not the Support Reauthorization Act, is absolutely critical right now. Great question, Joel. So just a couple other things that happened in December. We had some meetings happening, and I know there was another one, Liz, and I apologize. I know you went to the Hill too, and I didn't get it in there because I couldn't remember which one it was, and it wasn't on my calendar. Who did you meet with, Liz? Because you came into DC and met with a legislator, yeah?
Yes. So on the 7th, I met with Mark Warner's staff, and then on the 14th, I met with Tim Kaine's staff.
Perfect. Excellent. How did you feel about those meetings?
They were interesting. They were very warm and seemed interested in the information. Warner's staff was very curious, asked a lot of questions, but then at the end said he's not he won't what's the term, support something or, advocate for something that on the medical side that isn't something he has personal familiarity with, which was sort of strange. But and he mentioned two things. Apparently his daughter has diabetes and his mother is impacted, or his parents were impacted by Alzheimer's. So those are the two things that he would seemingly want to stand in front of and support, advocating in the front of the line, so to speak. And so that was good, but they were interested and they asked a lot of questions, and we gave them information. And then the next week we went to Tim Kaine's office, and that was interesting because we had the meeting in the hallway. That was the first time I had a meeting in a hallway. And it was a brand new person, had just, they had just changed the guard on who was doing what in his office. And so she wasn't new to Tim Kaine, but she hadn't been doing these things. So she seemed very distracted, but took all the information. And Tim Kaine walked by because we happened to be in the hallway. And as Chris pointed out, we wouldn't have seen him otherwise, but he just walked by us. We looked like a bunch of lobbyists with our heads in a little huddle. So I don't think he didn't think that they were constituents of his to shake hands with. But other than that, it was good. It was good. I really enjoy going down there, and I'm so close that it really energizes me when I'm able to do that.
Absolutely. Well, and I think that underlies the importance of developing relationships with our legislators. These are not one and done meetings. So this is not the opportunity to have one meet. Oh, I did it. I did my one meeting. I'm good. You know, that's not as effective as you did a meeting and then maybe you're following up with an email, right? And then maybe you're following up with another email. And then when you have a chance to meet with them again, giving them an update, right? Developing those relationships so they can get engaged with the topic. So they do have some firsthand knowledge. So they know somebody who's impacted by this. One of the meetings we had this month was with Representative McGovern from the great state of Massachusetts. And either Kristen or Ruben, do you want to give a little update with how that went and some lessons that you learned from that?
Ruben, do you want me to? Because you know I'll talk.
Yeah, go ahead.
Um, we've had several different meetings in Massachusetts with Representative McGovern. We actually met with him and a couple of his aides, and we had two family members because I took a trick out of Julia Rivera's book. Thank you. And I reached out to our families when we tried to have contact with representatives. And the families were able to talk. It was wonderful. He asked very few questions, except why is this not tracked and things like that. And then at the very end, he said, I just have one more question. And that is, why am I not already signed on for this? And his aide who was there was like, oh, I'll get on it. And we're still waiting to see it, the official, but I guess that's also tied up in red tape to get the official sponsorship out there.
Well, sometimes all you have to do is ask, right?
Right.
And I think that's the lesson learned from that is all you have to do is ask in some cases. And the co-sponsorship will come through as soon as the House and Senate are in session, because they can't put a co-sponsorship in if they're not in session. So if they have a pro forma session, which I think they might be this Friday, it may go in. But yeah, it's just important to just ask. And the Julia Rivera playbook is find somebody in your state who is in that legislator's district to join you on the meeting if you can, because that carries a lot of weight as well. So we are up to 45 co-sponsors in the House, 10 in the Senate. Last legislative session, we had 74 in the House, 10 in the Senate. I think we can beat that this year, or maybe we won't beat it because the bill will pass. And either way, I'm okay with that. But I think there's work still to be done there. Let's see. So what do we do now? Again, we want to continue looking for co-sponsors for the FASD Respect Act. If you had a meeting with your legislator 3 months ago, have another one. If you had a meeting with your legislator 6 months ago, have another one. It really is time to put the pressure on for that. With appropriations season coming up, it may be a little harder to get meetings with your legislators, but absolutely worth pursuing. Then some other things. Once the FASD Respect Act passes, states will give authorization to an agency to house whatever funding comes in from the FASD Respect Act. It's in your best interest, if you are working in the field of FASD, to figure out which state agency is best positioned for that and get to know them. Who are the contacts? Who are the people that might be handling that? Where might funding fit best? You may want to make them aware that this funding may be coming, that this legislation may be happening. So figuring out who those contacts are and doing that now, as opposed to waiting till the bill passes. You don't necessarily have to connect with them right now, but absolutely, do a Google search, look into your state agency, what state agencies who handles justice, who handles child welfare, who handles maternal child health, who handles disability. Look at those agencies in your state, who handles education, what agencies handle that, and then from there find out who the program officers are that most closely fit um, the FASD portfolio. And that's going to be doing some Google sleuthing. And, for those of you that are parents and caregivers of people with FASD or people with FASD, you're probably pretty good Google sleuths already, right? So it's a matter of searching it out, and you can always call and ask. I mean, these are matters of public record. So the information may be a little bureaucratic to get to, but you can find it. And that's why it's important to start doing that homework now and making a list. The other thing is to start making a plan if you haven't already. Who are the players at the state level who should be involved in anything happening with FASD? What disability rights groups? What, do you have a Department of Education or an Office of Professional Instruction, like we do here in Washington State, or a Bureau of Education? Do you have a Department of Human Services or Department of Health, State Department of Health? That would be another agency that might be. You could even go as far as look at smaller agencies underneath them, but I'd start with the big ones because they're the ones the state's going to be talking to. But I'd start documenting it and making a map of, mapping it out on paper, mapping it out on a spreadsheet, just mapping out where all these different connections are. Many of you work in professional organizations, right? And having a database or a spreadsheet where you keep track of this information so you can know who you've connected with, who you haven't, who you need to connect with. Have a strategic plan for doing this, because what we don't want to have happen is we spend all this time, effort, and energy passing the bill, and then states don't go for the funding, or they use the funding for things that just really aren't helpful for the people in their community, right? This is where we need to be the boots on the ground, ensuring that we're connecting those dots.
And I just want to add to that, Jen, and I had promised that for this meeting, but I didn't, with the holidays and whatever. I think there's two proactive things that the state can do to be in a good position to apply for these funds. One is connecting with the governor's office and having an executive order creating an FASD state program in your state. The other one is to have legislation creating an FASD state program. And I've started working on templates for both of those, and I should have those ready in January. So one would be contacting the governor's office with a template, and the other one would be going to your, finding who your legislative champions might be to create that. And so that will be a helpful tool. But I think doing this is really a good homework to begin that process.
And Sid had a question, and then I know Kathy has a question as well. So Sid, do you want to?
Yeah, we developed a matrix, California specific matrix that tracks state agencies and state funded entities, including the university system, that now have or should have responsibilities for FASD. And then we track the contacts, as you've mentioned, and state and federal legislation and funding streams that come into each of those agencies. It gets complicated. 17 agencies is a very complex network to watch, but there is somebody, and you mentioned the other players, there's somebody in the disability community that knows more about IDEA than we may. There's somebody that knows more about Medicaid and its availability for recovery coaches and peer mentors and some of the kinds of things that can be tremendously helpful to caretakers. But I think it really does require a fairly detailed map, matrix, template, whatever you want to call it, with an understanding that the state is likely to try to stick any new FASD specific funding in one agency.
Right.
That guarantees failure because it means that that agency will set forth on doing things it does and not necessarily involve or merely invite the other agencies to a meeting. And meetings are often part of the problem with collaboration because they substitute for real action. So that kind of a collaborative matrix can be essential. You start out with 2 or 3, you'll eventually find others that you can add, and that's part of the roadmap.
And Sid, thanks for bringing that up, because what the executive order and the template that we're doing is creating an advisory committee made up of the key agencies that will help guide what recommendations for how the funding, creating the the state plan, strategic plan, and making recommendations on how the funds would be used. So that is in the Respect Act, that language that the HHS secretary would put in the application process. So that's why we're going to put it in the template. So it's not, because I know you're right. It could go to Department of Health and they would say, oh, well, we're going to do a public awareness campaign and use all the funds just to do same old. And we can't allow that to happen. So it's kind of written in that way, the bill. And also we're going to do the template where you can get legislation or an executive order from the governor.
I think this Sid brings up another really, really important point, that this isn't something you can do alone, right? Just like FASD United can't get the FASD Respect Act passed without all of you, right? It's not something that we can do all on our lonesome. It takes everybody working together, and within your state, it also takes that coordination between different groups, different organizations, different people, to do this kind of outreach to the state agencies. Like Sid said, there's somebody who has a better idea of IDEA than another. There's another person that maybe has great relationships with Department for Children and Families, or whatever it's called in your state, right? Having those collaborative relationships in your state are going to be very important to ensuring that the funds are being used in an intelligent way and in a way that moves things forward. So really excellent point, Sid. Really appreciate your wisdom and guidance there.
Yeah.
Kathy, you had oh, sorry. Go ahead, Tom.
Just wanted to add to the conversation. It's such a good one and such important information. I mean, we're to this point because you all are assertive and have been so, and you're going to need to continue to do that within your state to ensure, as Susan said, that these funds are used appropriately. And as Sid said, you're going to have the relationships. Many of you already do, but that's so critical. And you also have to be thinking about, do you have an organization that can have a role? One of the things that the FASD United team has talked about early next year, having one or more, perhaps a series of trainings or gatherings where we could talk to you sort of checklist form about what you need, the position you need to be in, and what assets you need to have in order so that you can be a legitimate sub-recipient, sub-grantee for some of this money. And even beyond the state agencies, I mean, think about the universities. Many universities are addressing FASD in one way or another. They are potential recipients of federal dollars. There could be organizations and associations that are based in your state, in your market, and if not their headquarters, important chapters who also have a track record with federal dollars. So there are a lot of opportunities, but you have to continue to be aggressive as you have been, and making sure people know that you're expert in this area. You know, you're going to know from all these meetings the intent of the legislation, the purpose of the dollars that would go to states. But you know, in order to have an influence and even get some of the funding for your own organizations, there are a number of things to have in order with your organization and with your relationships. So obviously, this will be a continuing conversation. And one of the things also is to be able to, you could partner with FASD United, because we could work with you to try to capture funds, obviously, for use in your state. And so keep that in mind as well.
Kathy, you had your hand up?
Yes, I think we have really good relationships with most of the individuals, agencies that need to be involved, especially DHHS, although they're kind of a moving target because they keep promoting people that we have really been behind us. But the deputy director is clearly in our court, and she helps me get people beds when they need beds and stuff like that. But Susan, I was confused because I thought you said we shouldn't tie that to the governor, because then that if he does not get reelected and this is an election year and he can't run again, then that could be done away with by his successor.
Yeah, no, that's absolutely what I said. Sometimes if you know, it kind of depends on the situation. If you have a legislature that it may not be friendly to it, or if you want to get it going right away, and you have a good relationship with the governor's office, by all means, you know, you have to look at the situation and which one makes more sense. The long term, the legislative way is the way to go.
Okay.
Yeah,
we've Terry and I have started some preliminary meetings with folks, and there is interest in the legislature, but it is a divided legislature and governor office. So, but we have people on both sides of the aisle, I think, that will support us.
well, and I see Kathy asked about timing. We're looking, because it says in the bill, it says, I believe fiscal year 2024, but there won't be, we probably won't have I mean, if all goes well, it'd be nice to have funding for fiscal year 2024, but I don't think that's gonna happen. So it's gonna be 2025, but all of the once that authorization goes through, then the, you know, HHH secretary is going to start putting together the language for requests for proposals. So, you know, start working on it now. It's not too late. But, and it'll, you know, once we get it through, then, you know, people are gonna, oh yeah, now we gotta put money on it.
Well, the good news is that, you know, if you're working on these kinds of things now, even without the Respect Act passing, this is outreach that is helpful, useful, and necessary in your state if you want your state to become FASD informed. So none of these meetings are in vain or too early or you know, wasted opportunities. If anything, this is just bringing FASD, giving FASD another seat at the table, right? By having those meetings. So Carl, you had a comment?
Well, North Dakota's next legislative session will begin a year from Wednesday, next week, Wednesday. And we are already looking to draft legislation needed and working on drafting legislation needed to move forward with whatever the federal government passes. So now is the time to do that. We've built a coalition of people. We've identified where in the Department of Health and Human Services that might fit. And by doing the training that I'm doing for all of the social workers, I'm creating a network of people who believe, for whatever reason, I don't understand it myself, that I'm an expert. So, so yes, whatever you can do to start building that information or that network now this is the best time to do so. But of course, every state has its own legislative agenda and policies and all of that.
Absolutely. All right. So again, in talking about giving FASD a seat at the table, how are we going to go about doing this? And so much of it is in that relationship building, in that connecting, in that having a plan, writing it down. I can't stress that enough. What is it, Susan, that Arnie always says? If you don't have a destination, any road will get you there. Right?
Yeah, yeah.
So some projects that we've been working on at FASD United that may help in that process. And I just want to give you some updates on some of the things we've talked about throughout the year. We did complete the FASD and IDEA survey, and this was a replication of a survey that was done back in, I believe, 2016 with a paper that was published through the affiliate network. And I think Proof Alliance had housed it on their website. Ruth Richardson had helped out with that. And we are updating that information. And so we had almost around 700 families respond to the survey, asking the same questions. In some cases, we added and updated some questions because we want to see, okay, we measured it once and got this information. Now, a few years down the road, what's happened? Where's the update? So the next step is going to be drafting the position paper. We're all reviewing the findings right now. That's in progress, and I'll be happy to share some information on that coming up, probably January, February meetings. We can share some of the raw data and information. State report cards, and we're really struggling on the name for this because report cards feels really judgy. But maybe that is the way to go. We have collected data now, and by we, I mean, I got to give full credit to Heather French for doing the grunt work on this. Collecting data on all 50 states on all kinds of different areas in policy. So plans of state care or plans of safe care. Is FASD or prenatal alcohol exposure viewed as punitive versus non-punitive in the state? What's the legislative code behind that? Where can we find that in code? Things like, does the State Department of Health have anything about FASD on their website at all? So data points of collection that we're going to be compiling for your state that'll give you kind of an overview of here are some areas where policy might be helpful, and it'll give you some information to take back to your state and go, hey, here's some areas where we've got some gaps, so to begin to address those gaps. So like I said, all the raw data is now compiled. That was a massive job that just kept getting more massive because as soon as Heather would answer one question, we'd then ask her another one. We'd come up with more information that was needed. So really appreciate the work and the effort that she put in there. And Barbara, I see you have your hand up. Did you have a question on that? And I think you're muted still. Well, Barbara, when you get yourself unmuted, feel free to speak up, even if it's interrupting me. I'm fine with that. I know sometimes it can be a challenge to find the right button to do that, especially with the tech day I'm having today. Because I had other things I wanted to show you guys on this, and I can't show it to you, or my PowerPoint will disappear.
Barbara, if you're on a computer, if you hold on your space bar, you should be able to talk as long as you hold the space bar down.
Okay, this is a new trick. Let's see.
Really? Oh, that does work.
I just tried it too.
All right. See, we learn all kinds of things on the policy call.
This is so much easier than finding that mute button.
Yeah, if you spend as much time on Zoom as I do each week, you you pick up the tips and tricks. So, yeah.
All right. Last but certainly not least, Chris Melfi has done a ginormous job of putting together our stigma and language guide. Many countries have a language guide for talking about FASD. We have gone through review, stakeholder review, and now we're working on formatting that in a way that can be easily rolled out. So ways to talk about FASD that are non-stigmatizing, that are appropriate given current research. And so we're working on a suite of materials to roll out that will contain that information. And I really like Kathy White's suggestion of a state progress report instead of a report card. Using the school analogy, I think that's a good yardstick. So yeah, these are all things that we're, oh, Barbara, we've got you.
Yep, I'm unmuted.
Yay!
What I was asking is, who is the contact person that you've been getting this information from each of the states?
So with the states, what we had to do is actually go into the code. So looking at the legislation in the states. So in some cases we've had to call and ask, but in most cases we're going into the code, or I say we, Heather has done the job of going in and looking at the state's codes, the state's rules and regulations as it pertains to alcohol and pregnancy, or anything FASD related, and getting that information. And she's also saved references. We had her save references to where she found that information. So it's not just word of mouth, it's cited and there's a source to it.
Okay.
Yeah.
Because right now we're kind of in disarray in Michigan. There's a lot of things coming and going and passing in the night, and it's not very organized right now. So I was wondering, there is something on the website and under michigan.gov. So, that would be someplace where she probably was able to get some information, but I didn't know whether there was a person that she was looking to talk with, or.
Yeah. Well, and absolutely, in some cases, we know that, here's what the legislation says, here's what the rule says, and here's how it's actually interpreted in that state can be totally different. So before we go out releasing this information all over the place, we do want to get stakeholder input. We do want to talk to you who are actually feet on the ground in the state and make sure that the information we're putting out there is accurate, right? Because if it's not accurate, it's not helpful. And we want it, why bother, having Heather spend a year of working on compiling all this data if it's not going to be helpful, right? If it's not going to be accurate. So that's where, we're going to release the state sheets in batches where we can get that confirmation from folks in the state. And it's a good opportunity for you to go back too and talk to some of these state agencies and say, hey, here's what I'm seeing. Is this accurate? Is this, is this how it's being interpreted? Is this how it's being used in our state? And it's a door opener for a conversation, right?
Well, there's a prevention network in our state, and is asking or saying that they would be happy to do the prevention part. And that's just come up in the last week or so, and that would be wonderful, because I don't think anyone's doing much on prevention. The thing that we're doing the best on is supporting families. And of course, that's never enough, but that's the main focus in Michigan right now. And parents are trying to live from day to day, and they can't even think about prevention. But this agency is totally on prevention. of substance abuse and at college levels and things like that. So it seems like it fits in. And would that be possible? Do they have to be connected with some quote FASD agency?
Not necessarily. I mean, I think this is where these coalitions come into play. Like what they've
Mhm.
done in California is having multiple stakeholders who are invested in the idea in you know, either healthy pregnancies or supporting families and caregivers of people with FASD and people with FASD, or, you know, there can be any kind of focus on it. The point is that you're collaborating and talking to each other and working together to affect change that is going to help everybody in the state. And it sounds like
Yeah.
that's very much the situation you're talking about.
And years ago, we had an intercollaborative group, and they met once a month, I believe it. I don't think it was more than that. But that's not there right now, so it has to be recreated. So thank you.
You're welcome. You're welcome. Any other questions on any of these three project updates? Any other thoughts or suggestions? So with it being the end of the year, I just kind of want to start the new year, really. Rush past these last couple of days or maybe take some time to reflect. But really focusing in on this, how are we going to give FASD a seat at the table in 2024? What actions can we personally take? What actions would you like to see FASD United take? What actions would you like to see your state organizations take to give FASD a seat at the table, to have FASD be included in decision making when it comes to funding, when it comes to policy, when it comes to inclusion and training and support? How would you like to see that happen? And I really encourage you to take the next couple of days as though it were 2024 and start writing out those lists and writing out those plans if you haven't done it already, and making those plans for how you're going to do that. Because if you don't have a plan, you know, what's going to happen is going to be an accident, right? And we don't want to leave this up to chance. So definitely happy to stay on and answer any questions you may have. And I did want to share some information that was shared in the chat and just give our support to Shirley Sparks's family. She was involved in the FASD community for many years and definitely devoted so much of her time, energy, and effort to making the world a better place, particularly for people with FASD, and give thanks and acknowledge her passing.
Jen?
Yeah.
Yeah, I just wanted to say, I want people to note that her first article was 40 years ago. 40. And she never stopped being an advocate. So let's hope it doesn't take another 40 years. Yeah, she recently formed the parent support group here in Santa Clara County. And and to note too that I put in there, her last article was with Sid, with the Child Welfare Journal. So it should be an inspiration for all of us. She was amazing. So rest in peace, Shirley.
Definitely. Thanks, Barbara. Thank you for mentioning that. Liz, you had your hand up?
Yeah, yes, I do. I've got more of a general question in terms of thinking as we go away from this call. So, is it possible that, let's say that let's say it passes through the Support Act and it get implemented, I would think that there's organizations that are much, sort of have the greased process around getting funding, and they're constantly looking for funding and putting in grants for things and things like that. Is it possible that those people are going to be way out in front of us on doing this in our state, such that there's going to be, the money's going to go away quickly, as opposed to us, having it be FASD focused? In other words, there's going to be some criteria that requires them to be FASD focused, such that, if we don't figure this out in our state for a few months, that we're not going to lose out in the long run. I'm just trying to understand how this, you envision this working, because I'm just thinking that there's organizations that are going to hear about this funding and are going to go for it, because they've already got their process already in place in the States. So can you just comment a little bit generally on how it might work, that the work that you've asked us to do today, and obviously on prior calls in terms of us, but some states are well ahead, better position for this than others in terms of who's doing what with FASD. So,
well, this is where collaboration is key, right? This is where, we talk about FASD not having a seat at the table, but in some cases, we've sat off at our own table on the side, only talking to FASD people because that's where our comfort level is. That's where we feel understood and appreciated and acknowledged, right? As opposed to engaging with the broader disability community as a whole. So yeah, there are going to be other folks out there wanting funding. And I think it's important to recognize that we have to be guarding these funds by engaging with any organization that may want to participate in this, and making sure that they have an understanding of FASD and educating them about it. Because at the end of the day, what we want is what's best for everybody with FASD, right? And so I think this is where, I think if I went back a couple slides, I don't know if it'll let me, talking to other disability rights organizations in your state about how they might get engaged, and just being upfront on that, and building those collaborations. Because if you have all the FASD knowledge, but they have the wheels greased, well, isn't that a great opportunity to collaborate? Right?
Yeah, and that makes sense. And a lot of, I mean, at least in the state of Virginia, they do all their, because of the nature of the legislative session, they're doing everything in January of the year. So like the developmental disability advocates are going down to Richmond, for example, in Virginia, and it's all being done in January, because that's the only time you can do it for the whole year. So I, as an individual, have been participating in that really as an embedded, because I don't know any other way to learn how to do this in my state. And talk. And so I envision talking to them about, what do we do about this when it comes, and how do we partner on that? But I mean, I'm an individual, right? And I'm just trying to understand this. I'm just afraid we're going to look up and the money's all going to be gone. That's what I'm kind of envisioning here.
Well, I think you're doing some really great things there by engaging with the broader disability community as a whole, because absolutely, other disability organizations that are not FASD focused are going to see the opportunity to get involved with FASD, right? Because, if you look at organizations now that serve the broader disability community, many of them don't really have anything FASD related there. And it's largely due to funding. If their grants don't cover them working on FASD, they're not going to work on FASD, right? Because their grants don't cover it. And so getting involved with them, getting engaged with them, getting them understanding FASD, in some cases, those agencies can and will, if they have the leeway in their grants, they will do some FASD work and start getting FASD informed. But yeah, I mean, that's one of the risks. And then the other piece too is looking at those that are going for the grants, making sure they understand that they have an obligation and a really a duty to, if they're going to benefit from the grants, they need to be involved in ensuring that those grants stay put. So they need to have an advocacy arm, they need to have a policy arm, and FASD needs to be on their policy agenda. And if it's not, well, then, you know, that's a problem. And that's where, as Kathy Hotelling put in the chat, being on their advisory committees, right? And being part of the advisory committee on the state, that can also help. So just getting involved, right? This is grassroots 101, get involved where you can, right? It's not easy by any means, but
and how long does the funding go for that is in, let's say the Support Act gets passed into law? How long will that funding be available for? Is it multiple years? I just can't remember what the language says.
so that's going to be dependent on appropriations, right?
Okay.
So we're going to have to figure out with the appropriators what we can get and lobby for that too. So if we're lucky, you know, it may get inserted into a budget item here or a budget item there, but odds are we're probably going to have to work for it and get those appropriations put through. And that's part of why this whole season of reflection and making the lists and putting together the plans now is so important, because when that money hits, we want to have a plan in place before it hits. We don't want to be waiting until it passes. Let's start building those networks now. Start building those relationships now. So that way you're ready when the funds come, right? Because let's say it's dependent on appropriations and we don't get put in any budget. When we end up working 2 years, you know, the bill passes, but there's nothing appropriated with it. And we work 2 years on getting appropriations passed, right? That can happen.
Yeah.
We're hopeful it won't. We're doing everything we can to try not to have that happen, but that's absolutely a possibility. So, you know, this is where it's never too soon to start building those relationships. And kind of why we're harping on it in this call so much is because like, if you haven't started doing it yet, now is the time. You've got to start doing it.
And the authorization language, I believe, is fiscal years for 4 years or 4. So it's this, and so the authorization is good for that many years, 4 or 5 years. But you get the authorization, you got to get the money. And if it's such sums, you know, right now we know there's 11.5 million in CDC and 1 million in HRSA in that agency. So maybe they'll come up with, you know, more money for the other programs. Well, you guys have to stay tuned. I mean, you're already wanting, and I think this is great.
It is, you know, Liz, let me add to that to reinforce what Jen's saying. The more you can remain an expert that you are in FASD and understand the issue and understand the landscape and the environment in your state, in your area, you don't have to worry about when is the money coming, where is it going to be, how long. That's why you're going to stay connected to FASD United at meetings like this. We are tracking along with that. And as you saw today, you know, as Jen advanced by a square where we've been, but that in previous meetings we had been stalled a little bit. Well, that can occur. And it can also occur where there's a rapid acceleration in progress. If things pass and then we find out what agency the funds might go to, or authorization passes, appropriation comes along simultaneously. Is it possible? Could be. You know, another fiscal year working on that. But if you stay connected to us, we will be sharing with you that process, that progress, where FASD ultimately is, what agency, whether it's, you know, the funding for the expansion of FASD, when that money might or when a funding announcement might hit the street. what might be in that announcement, and what do we have to do to prepare to respond most appropriately. So all of that is why you're connected to FASD United.
And
And you,
and also I'd want to emphasize the new money, as symbolically important as it is, needs to be compared with $500 billion a year the federal government allocates for programs that benefit children. The seat at the table philosophy frames the question, how are you getting the fair share that FASD affected children and families get from that 500 billion? When you add state and local and private funds, you're talking about $1 trillion. FASD does not get a fair share, a proportionate share. And the new money ought not to distract us from the Willie Sutton problem. That Willie was a bank robber who, when they asked him why he robbed banks, he said, because that's where the money is.
and you know,
We have to remember the Willie Sutton lesson.
Well,
Yes.
and that's why we're building that foundation, Sid. You're exactly right, because you can't put another silo for FASD. We've got to, get it ingrained into our system of that trillions of dollars that should be FASD informed.
and as you build your relationships thinking, okay, when are these federal dollars going to hit? You may realize, wait a second, there's an opportunity for state funds. You've done just what Sid said, and you've raised the awareness of this issue among key people where they come to understand that they need to support this issue. And you may find out Susan in Indiana has been able to capture federal dollars, many other folks in Florida, and on and on and on, not to mention, obviously, Minnesota. And so by building those relationships, there could open you up to a great deal of other opportunities. It'll also help us do, again, what Sid is talking about, a concept there, is leverage this issue and say, look, your policymakers care about this, lawmakers care about this, increasingly the agencies care about it. You need to include FASD in other funding streams, or make FASD projects options within other grants. So all about the relationships.
Joel, you had your hand up?
Yep, I did. Along the lines of the new money coming through, are there policies of where the money needs to go? And with that, is part of that a state director for our particular issue? And kind of segue or expand is, can we coordinate with the new money, even on a national level, some sort of flow that has to happen in terms of how it should be allocated? Just thoughts. Do we know how the money is to be allocated?
Well, you have you have the old authorization, and then you have new programs that were added to that for the building FASD state and tribal systems. So that's one section, and then you've got the Centers for Excellence, which is another section within the RESPECT Act. And the building FASD state and tribal systems will go out in an RFP, and states will apply. And it's going to depend on how much money there is in the pot, and how the secretary manages it. But these are all, once the language passes, then they have to figure out how, what the RFP is going to say for those different pockets of money.
Yeah, just getting in preparation. I just didn't know if part of the money has to be spent on a state director, and you're answering some of those, so we would know how to get.
Yeah, there is
prepared.
language in that amendment that went into the support language. It's not in the bill as introduced, but it was in the amendment into the Support Act that says that the Secretary of HHS may have that as a requirement, that there be an FASD state director and that there be an advisory committee. So that was added to the Respect Act language. So.
Yeah, I
and we're
just want to know how to best be prepared.
Yeah, we want to make sure we weigh in with the HHS secretary when, you know, and make our recommendations on what that should look like, because there was more detail in the original Respect Act with regard to that, but we did capture that in the amendment that went into the Support Reauthorization Act. Because
And then-
that's really important, a piece. Otherwise, what happens is what Sid talked about. It can be just gobbled up by a state agency and it loses its, you know, systemic focus.
Well, and along that line is just, can we collaborate on a national level of how that money should be distributed to help with that policy so it stays where it needs to stay?
I think that's absolutely going back to Tom's statement. This is where, you know, we want to try and support that coordination. And by giving all of you the same information so that you can take it back to your states, some templates, things like that, so that we can try and, you know, keep things consistent with where the field is now, as opposed to where somebody who might be brand new to the field, you know, there's a trajectory that they usually follow until they have a full understanding. You know, we want to get people up to speed as quickly as possible. So giving you some tools to be able to do that in your state so that we're all doing it together, I think is a good way to go.
Thank you.
You're welcome. Well, I said we were going to end early and we are now ending late. So this is how time goes for me. I want to thank you all for being here. Wish you a very, very happy new year. And I am so stinking excited about what we're going to accomplish together in 2024. This has been the journey of a lifetime, and I'm really grateful to be doing it with all of you.
Ditto. Happy New Year.
Happy New Year.
Happy New Year.
Happy New Year, everyone.